Welcome to the Diary of a Working Woman podcast. I'm Jonette, your host. On this podcast, I'll be speaking to women from all walks of life of different ages. And the thing that they'll have in common is that they will work in some way or another. Their stories will be motivating, inspiring, empowering. I just know you're going to enjoy it. Please follow me on Diary of a Working Woman to receive all the latest episodes. Tune in.
Today we're talking about a very important topic, that of mental health and mental health disorders. You may be aware from all the media coverage that there's been a sharp increase in the number of diagnoses for conditions such as anxiety and depression, particularly since the COVID-19 pandemic. In 2020-23, there's research that suggests that as much as over 20% of children from the age of 8 to 16 years old are likely to have a mental health disorder in the adult population globally. So I'm absolutely delighted today to have a psychiatrist on the Do It podcast who's going to talk to us about her work as a psychiatrist. And she is here, and it's Dr. Aneesa. Hi, Dr. Aneesa.
Hi, Jonette.
Hi. So Dr. Aneesa Peer is a consultant psychiatrist based at the South London and Maudsley NHS Trust, where she's worked for just under 20 years. So she specialises in anxiety, depression, psychosis, and she's also a trauma specialist. Now, as part of her casework, she works as a systemic counsellor, supporting couples and families who are working through mental health problems. As well as all of that, Dr. Aneesa is the mother of 3 lovely children. So welcome.
Thank you, Jonette.
It's lovely to have you on. Congratulations on your journey, and you're very experienced. I'm interested in why you decided to specialise in psychiatry and what your motivations were.
Gosh, I haven't been asked that question in a very long time and haven't had to think about that. But I guess my interest in psychiatry started during my training. Seeing, having to assess people with mental illness, inpatient units in South Africa, which is where I trained. It was very interesting. I got to see the interface with mental illness and systemic, challenges that people face, and how that, their development, their growth, and then, their interface as they entered working life. Mental illness is something that originates or starts very early on, often in people's lives. And so I think that sort of developmental aspect really intrigued me during my training. And so, it became one of the sort of more interesting aspects of medicine that I sort of always, found myself gravitating towards through my training. And then when I came to the UK, I specialised in psychiatry at the Maudsley. And so, I think the mind is a very intriguing thing, a beautiful, interesting and intriguing aspect to our being.
So the mind can be positive, the mind can be negative. The mind drives your mood, your feelings, your behaviour. So it is really, really important, isn't it? Now, I know that, people will have an idea of what a mental illness is, but from your perspective as a professional in this field, what are we talking about here? What is it? What is the mental illness?
I think it's a difficult thing to sort of categorically put into a defined category. What I would say is that it's a spectrum, and it is something that can go all the way from, can start off as a little bit of anxiety about approaching a task, for example, that can then become a bit more challenging to manage and problematic, and can interfere with other aspects of your life. And then it can go into something more debilitating. And that's where, I come in, is when it suddenly becomes, or gradually rather becomes something called serious mental illness. And that's when the psychiatrist would get involved and would start prescribing, etc. Illness is possibly, we could say, the lack of health. It was a way of framing it. And I think health is more around functionality and how functional we are. But it's a spectrum, and I wouldn't like to say it is one thing or another.
I think that's really helpful to frame it as a spectrum.
Yeah.
Because we're all on the spectrum, aren't we? One thing or another. And it's really important, I think, when it comes to mental health, to normalise it as much as possible, to avoid stigma. Because I think that's why some people don't come out and express how they're truly feeling, because they do not want to be judged, and they don't want the stigma, they don't want to be treated any differently. So it's important that you mention that it is on a spectrum,
and it could happen to anybody. It would come about at difficult times, and often we find that people who experience adverse life events, so either in childhood, adolescence, or even later on in life, people who go through a serious relationship breakdown, and that can be a trigger for a depressive episode, or what we call an adjustment disorder, which then doesn't quite heal, get better, and the person becomes quite depressed. And so it could happen to anybody, and I think we can talk more about preventative ways and what we can do to protect ourselves from. We can't necessarily protect ourselves from adverse life events, because we never know when they're going to happen, like an accident, etc. But I guess what we can do is protect ourselves in a way that would help us to manage a situation
better. And I think it'd be good, we can touch on some of those, some advice and strategies as we progress through the podcast. If you are enjoying listening to Dr. Peer today, please tune in to the @Doer podcast. That's Diary of a Working Woman, where you'll find out more about mental health, and we will end with some signposting, really, so you can get support if you need it, or a friend or family member is in need of support. We've heard that mental health is on a spectrum, and mental illness is on a spectrum. There's a school of thought that mental illness is hereditary, and then others believe that it's actually more environmental. Is it a combination of both? Where are you coming from with this?
It's definitely a combination. However, for what I call SMI, serious mental illness, like bipolar affective disorder, schizophrenia or schizoaffective disorder, depression, there's a very strong hereditary component, and it could run in families, or does run in families. And so, we find that, maybe a parent would have maybe something like postnatal depression and go on to have depressive illness in life later on, and the child at some point will have depression. And so it's not uncommon, it does run in families, unfortunately. But that does not preclude us from thinking about how to, or does actually possibly how we could frame it, is that it could enable us to have the conversation about how it is that we protect ourselves for future episodes, and what is it that we can learn from our loving mother or father or partner, a child, that's experienced it, and how we can sort of support each other and the person.
It's all about the support, isn't it? But I suppose before we get to the support stage, we do need to know what those triggers are. We do need to understand the symptoms, and we do need to have a bit of knowledge of all these different types of illnesses. Now, I know that you're a specialist in psychosis, for example. We hear a lot about anxiety, depression, so much ADHD these days, but not so much about psychosis. So what is that, and how do you spot that?
Yeah, people are very sort of, curious about what does psychosis mean, and often my patients would say to me, but what does that actually mean? Well, psychosis is, people can say, well, reality is possibly subjective. So sometimes people would say, well, religious views. Very often I hear that people say, well, I believe in hearing the voice of God, or seeing a spirit, or whatever it is. And I think, yes, I think we have to sort of contextualize, our experience, and we can't be too sort of rigid about it. But when it becomes a problem, we have to be very clear that psychosis is being out of touch with reality, hearing things that other people don't hear, usually voices, or experiencing beliefs that are very unusual and peculiar to you. Often people would say, I have a relationship with the Queen, or the family, the royal family, or, and then people become what we call manic.
Right.
So they would have other symptoms alongside it, but delusional ideas. So you would get, that sort of manic or hypomanic flavor to their psychosis. And then other psychosis would be paranoia, persecutory delusions, feeling watched, feeling followed, believing that someone's coming after you. And even in the sort of confronted with the evidence that that's not the case, they would still hold on to
real to them.
Yeah. So 100% sort of conviction in the delusion.
And then how do you manage that? Let's say you are living with someone who's sort of showing these sort of symptoms, or of a friend or a family member. It's a very sensitive subject, isn't it? How do you broach it with the person? Because obviously they're out of touch with reality, but they can't see that. But you can see.
Absolutely.
What should you do in that situation?
It is a very, very complex and very sensitive and delicate scenario. And we get this a lot, especially in our setting in London, where families lived very closely with their loved ones. And, in some communities, there's a lot of distrust for the pure medical model or the Western model, and that's completely understandable with the historic sort of racist, imposition of mental health, the legacy of institutionalization, etc. And the disparity in the way people are treated across racial and ethnic grounds. And I think we need to be very, very clear about there's a real distrust with, with services, etc. And people then sort of withdraw with their family member. They want to sort of keep them at home and not really seek help. I would say to always seek help, because it can be quite distressing on your own having to manage that situation. But yes, I think the support for the family is essential, and having a systemic approach, which is, I find that very rewarding working systemically with families and members with mental illness and their loving ones with mental illness. And it's about supporting them, taking into account their view and really validating their view on their position and what's going on.
But what if they resist that support? Who would you call in this situation? Let's take it right back. Who do you call?
Well, we try and gently be there and support them, even though they may not want the support. Check in gently. There may be one family member who's reaching out, the others may be closing up. And so we gently connect that way. We show them other ways that there may be things that we could offer them that are not medication necessarily, therapies or, housing related matters or financial matters, sort of access people in different ways, because these things all come together to create the stress.
Absolutely.
And so accessing people in different ways, being creative in the way we can support people.
So do you take direct referrals from the public, or would you have to go through the person's GP? The GP?
Mainly through the GP, unless they're in a crisis and they go to A&E. So it's usually A&E, and then we get referrals that way, or through the GP. Just go to your GP and say, I'm really struggling with my family member, and I'd like to be assessed. I'd like them to be assessed before it gets to the point where it's unbearable and very difficult.
Sure. And where does you've said they hear things, see things. What about, and I'm sure this is normal, and sometimes I hear myself doing it as well. You're talking to yourself. Absolutely. People talk to themselves, especially, following COVID when you were isolated. Yes. How concerned should you be if you witness a family member who's constantly talking to themselves? Is that something to worry about?
Yeah, I think that we need to sort of be very accepting of difference. I think we're moving away from that very rigid medical model of, everybody needs to be grabbed and put onto treatment. Yeah. We're moving away from that. And certainly I don't practice that way. I see the spectrum as in, people may hear voices, and the voices may be even soothing for them or may serve a function for them. There is the view also that as long as you're not treating psychosis, it's going to become difficult to treat it when you do treat it.
Right.
So there is some evidence that shows that it's better to treat it early on because you have more chances of success with treating it. However, it shouldn't be at the cost of, destabilizing the person's psychological. So it's complex in that, we're trying to balance our wish to treat the person with where they are in recognizing and having the insight. Insight is a very big thing in mental health, and recognizing fundamentally that you need the help, that something is amiss and that you need the help, and then taking that first step to accessing help.
Wow, thank you. That was really clear. So psychosis, an episode out of touch with reality, but it is still on a spectrum. I think people are definitely very aware of how depression can manifest in different people. And I think, again, you've mentioned environmental stresses and, going through a difficult time with bereavement or what have you, a breakup in relationship and experiencing depression. But when does depression become a concern? Because, I'm going to mention this, people that we will know of a certain age. I've got lots of friends around me who are either going through pre-menopausal stages or through the menopause, and they've experienced anxiety and a lot of depression. When does it come out the realms of normal?
I think, that's a very relative and subjective experience. And so what one person may experience may be normal for another. And some people can experience the perimenopause very early on. So in their early 40s, mid-40s, and obviously, some people go through it effortlessly with no notice, right? And others would be completely destabilized by it. So again, we're talking about a spectrum, because we all sort of within a spectrum of presentation. What we're talking about here is women recognizing for themselves that things are not the way they used to be, and things are changing inside them, and their interface with the world is changing. And that can be from simple things like, a little bit of brain fog. So you get up and you're sort of struggling to concentrate some days, or you sort of struggling with your energy levels.
Lack of motivation.
Absolutely. And then relationships, making the effort to go out and maintain your relationships, or doing things with the children or your partner, and then just sort of wanting to be indoors more, and then losing your confidence sometimes, and sort of really, feeling a bit wobbly,
Wobbly is a good way of describing it.
Yeah, not yourself.
Because you're not quite ill,
no,
but you're just not quite right.
Yes.
Yeah, so wobbly.
Yeah. And if you think about your hormones are so important, right? Your estrogen and progesterone, they're so important for your functioning, for your bones, for your mind, for the other functioning of your other aspects of your health. So we're really dependent on our hormones. And if our hormones, just decline quite suddenly over that, 5-10 year period, we're looking at significant change in our bodies and then in our minds. And so we can't expect to be completely the same. And I think that we think less about the preparation in our late 30s, early 40s. How do we prepare ourselves to that? And women, there's never been enough research on women's issues. And we're always playing catch up, and we tend to neglect ourselves at the expense of, our children.
Caring for everybody else. Yes.
Exactly. Yeah. And the system does the same thing to us as well. And so, yes, there's a lot of sort of awareness about breast cancer and serious conditions, but which is something very natural, like the perimenopause and menopause, is something that's overlooked to a large extent. And it's only recently that people are now thinking about this is very serious for women.
Because it's debilitating, isn't it? It affects your mood, just everything.
And it's always been the case, you just get on with it.
Yeah.
You just hold your head up and you just pretend.
It's like pregnancy, isn't it? When you start, complaining about feeling the morning sickness that goes on for the entire pregnancy, and people say, well, what do you expect? You're pregnant, just deal with it.
And you'll get women championing that it's okay, that just get on with it.
Yes.
You think, well, actually, you've been here before.
Yeah.
You should be
absolutely
more compassionate.
I know you're a doctor, but you know what? You're just saying that. I just had flashbacks of being in hospital to really tricky pregnancies with this hyperemesis gravidarum, the sickness.
Oh my goodness!
I had that so-called morning sickness for the entire pregnancy, and the moment it stopped at the moment when both babies came out.
Wow.
And I think, you know, sometimes medical practitioners are the worst for empathy and sympathy.
Yeah.
I remember the nurses being completely unsupportive and just saying, look,
Yeah.
you know, that thousands of women have gone through this, you will be fine, you know, just get on with it when you're feeling actually really, really, really disillusioned about life. I remember lying in the bed one day just thinking, do you know what? I just want this to be over. I cannot take this anymore, because every single thought in my mind was sort of just consumed with this feeling of sickness and hopelessness and helplessness. So I think I went through a depressive state when I was pregnant. Personally, when I look back now and I think how I was presenting, and my partner found it really difficult managing me and the pregnancy and everything else. And so, you know, how do we support our friends, our family members who are going through these mental health periods of mental illness? How is it best to support them on a day-to-day basis where they don't want to leave the house? They're feeling sometimes suicidal in some cases. What do you do? Because the inclination is to withdraw from everything and from society, when really they need to be reaching out, don't they?
Absolutely.
Yeah.
It's a really tricky one, because you want to sort of meet them where they are. I always say to people, where are they at now? So we can want a lot of things for other people, but it's really important for them to start thinking in themselves first, and then to meet them where they are. And it's very difficult for families to hear that, you know, because they sort of want to sort of, you know, just roll up their sleeves and just, let's just get in there and do this and do that for them. And that can be overwhelming for someone who's depressed. And depression can be a very heavy load to bear. And, you know, you're sort of interfacing people who are not depressed, and you're recognizing that you're different and you're in a different space and zone entirely. And so you really want to meet them where they're at, firstly and foremost, and then gently start things activating them. So I would call it behavioral activation, and it's a tool that CBT therapists use very early on with depression. And that's really sort of, I say this to all my patients, on a Sunday evening, plan your week. No matter how you feel, with your support system, with the person you love, your parent, your partner, your child, plan your week. So Sunday evening, Sunday afternoon, say, I'm going to do this on Monday. Put 2 things in the diary, even if it's half an hour walk in the park, you know, or, you know, take out my mindful book and do some mindful, but put it in the diary. 10 a.m., this is what I'm going to do. 2 p.m., this is what I'm going to do. It doesn't have to be anything extravagant, anything difficult that's going to demand a lot of you. But if you have your diary, your calendar for the week, and you've got 2 things in there, you will get up on Monday morning with the idea that you're going to have to do this. You're committed to this the day before, and your week will be done. You will find that activation itself releases the serotonin, releases the happy chemical. And as it's released, you will feel good, and you will have that motivation to do the next task at 2 p.m. And you will go away that day, go back to bed feeling a little bit better, more achieved. You know, you've ticked what you've done for the day. And there's that motion, that sort of very human behavior that activates us, that keeps us grounded, keeps us focused. Because if you can imagine the complete converse, you wake up in the morning, you don't have anything in your diary.
No structure.
Nothing.
No routine.
And so you've got no reason to wake up, right? So you might as well spend the day in bed.
Yeah.
And there's no planning. The idea of planning something is putting you in that metacognitive space for yourself. You're looking after yourself. You're already taking that position of, I'm caring for myself, right? So I'm already making a decision in my best interest. It's a very powerful, you know, way to sort of reframe that sort of depressive cycle. And of course, you may not do one thing, you may not do anything, but
it's the intention, isn't it? And you've got the intention.
And then the next day you wake up, say, well, actually, I didn't do it yesterday, but let me start today.
Absolutely. So behaviour activation.
Absolutely.
of encouraging you to have a focus for your
Yes.
life, so you're not focused on your anxiety or the depression. And as human beings, when I suppose, we like to get things done, or most of us do anyway, and be very task oriented, because that keeps us busy and it keeps our minds occupied. So that is really, really helpful.
Behavioral activation is a way of setting yourself a target and then achieving it and feeling like, actually, I can do something.
Yeah, you're worthy. You're worth something. Yeah.
It feeds into so many systems of self-value, self-compassion, self-appreciation.
So when you get, I know your patients are at the extreme end of mental health, but when they get to your stage, your point, are they completely lacking in any sense of self-worth?
Yes, more often than not, things have been tried and tested, and things are not going very well. And so we have these tiny steps are so valuable. Yeah. We cannot underestimate the tiny steps in our lives that take us to bigger steps to make more significant changes. And so I really sort of hone in very, very difficult things. People don't brush their teeth for months at a time because they don't have the motivation, they don't have the energy, they don't have the will, right? Because they just don't see the point. And so brushing your teeth, even once every 3 days, it becomes something you've achieved.
Yeah.
Right. So if you can imagine that degree of self-neglect, it becomes quite a feeling of being insurmountable. And then you suddenly, take that step and things start changing.
It's hard to fathom, isn't it, that people would get so low that they haven't got the motivation to brush their own teeth and that basic physiological care, looking after their basic needs, and presumably not eating for days or just completely neglecting yourself.
Absolutely.
So do you get a lot of people who are living by themselves? Because presumably it's a little bit easier if you've got a support network around you that can, look out for you and support you. But if you're completely on your own,
it's very isolating. And the nature of depression is that you seek isolation, you seek withdrawal, you want to be on your own, and you end up, people sort of leave you to it often unless you get very, very motivated, very engaged families, which is not very often the case. A family member who will literally have the key to your door, get inside, start tidying up the place, and at the risk of you being told to bugger off, just go on.
It's been polite. That's hard. I think it's hard because on the one hand, if you're living with someone who's showing that sort of behaviour and they're becoming more and more withdrawn, then part of you wonders whether or not they just need time alone, when really perhaps that's the very thing they don't need. But how do you make that judgment? It's hard, isn't it? If you're seeing that there may be a potential problem and you're reaching out and they're pushing you away, or with friends where they've reached out and they said, I'm suffering, and you say, right, okay, let's organise this, let's try and do this, and then at the last minute they cancel because they can't cope with it, they feel overwhelmed. You can feel stuck, you can feel disempowered as a friend, as a family member.
Absolutely. And I think it is a balance between, sort of looking after yourself in the process, because I always say to people, you look after yourself first, you put your own mask on, look after yourself, because it can be quite disheartening. You feel rejected by the person. But then also conflict is not ideal in that situation. You're sort of leading yourself into a conflict situation. And depending on the nature of the person, sometimes a little bit of conflict can get you a little bit get away with it to the point where the person will engage and accept the help. But you don't want to be there. You don't want to, push the person away any further. It's a very tricky thing. And I think we're sort of contending with that daily with our families. And depression is possibly one area that's very, very difficult. But psychosis is even harder when it comes to your family member becoming paranoid about you and your intentions.
Yes.
And then you become the source of their paranoia because but all you're trying to do is trying to help them.
And they don't see it like that, of course. It's very difficult. So we touched on psychosis and depression. We've talked about menopause and hormonal imbalances and changes, and talked about partners and friends and who are probably showing signs that they need support with their mental health, but not necessarily wanting that support. So I suppose it'd be good to talk a little bit more. We've weaved anxiety in, and is anxiety at the less extreme end of that spectrum, would you say? Because we all experience anxiety, don't we?
Absolutely. So anxiety would be, also a spectrum, and the everyday anxiety we say is healthy. Sometimes, just you need a bit of anxiety, you need a little bit of adrenaline to keep you going, to get out the door, to face things. It's when it becomes unhealthy. It's when we're using the stress to cope in a very unhealthy way without the preparation required, and we put ourselves in situations where we sort of overwhelming ourselves. Anxiety is good up to a point, and then too much anxiety becomes counterproductive, and you're suddenly struggling to actually function to the degree that you were before. That's all about preparation and looking after yourself. So knowing yourself, I'm all about people knowing themselves. That's my big thing with my patients. Get to know yourself.
How do you do that? It sounds easy. How do you get to know yourself when you're feeling depressed or you're always anxious? You don't feel good about your body, and social media is making you feel like
Well, this is the
rubbish.
thing. When you interface the world, you take a lot of the burden of the world and other people's problems, other people's experiences of the world, and you believe that you have the same thing, or you need to go through life the way they're going through. Everybody experiences life differently. Right? We all need to value our unique experience of life. And that starts with your earliest year, your earliest attachment. Your relationship with your primary carer is different from your own siblings' relationship with your primary carer. Can you see how different we are and unique as individuals? So if you think about your earliest relationship, that is usually your determinant for your future relationships. Right. And if we understand our earlier relationships and try to sort of adjust ourselves as we go along based on our attachment style.
Attachment styles. Oh, that's a whole subject in itself.
Well, it's very important because it's about, how we attach earlier on. And our attachment then relates to how we relate to our relationships, our work relationship, our relationship with our work, our relationship with our study. So attachment is a very significant contributor to how we live life generally.
Absolutely. And, just touching on this attachment, obviously, for people who have grown up as a child having secure attachments, and these relationships and these life stresses are going to be so much easier to navigate. Absolutely. Is when you've got those, you haven't got you've got the insecure attachment where the problems can become huge if you're not aware of them, isn't there?
And I think, with the stresses of our parents, and, if you think about the particular stresses of our parents and how, there have been lots more systemic demands on our parents. If you're an ethnic person or, person who's been through struggle from a history, a legacy of struggle, that then gets transferred onto your parent and their experience. Absolutely. And they're going through struggles, right? Okay. And so we have to make allowances for that. And we can't sort of say, well, a person who's been through a migrant, for example, an immigrant or migrant family, their experiences are different from someone who's lived in a secure sort of setting
all their lives,
right? So we have to consider that and think about what would that experience have been like for that person, for that mother who's traveled across the continent, come here, lived a very sort of, a tumultuous sort of interface with the systems around them. Right. And then having a child, and what was her support around, at the time, what was the care like for her? We know that there was a lot of racial disparity.
Absolutely. And continues to be in pregnancy and childcare.
Absolutely. I mean, Black mothers have it the worst when they talk about the obstetric outcomes. So we have to be realistic about what it is that our parents have been through, what we then would have been through. In spite of that, our parents would have loved us a lot. But then there would have been challenges, and how much of that would have been projected into us as children.
That's so important. And I think there would have been lots of challenges coming from all angles. And, with some parents, their parenting style, potentially because of their own parenting, how they were parented, is that they may be actually more task oriented,
yes,
and may not be able to demonstrate their emotions and show affection emotionally.
Absolutely.
And therefore, when you look 20 years, 30 years, 40 years down the line at the person you once were and you're a child and you are now, you may not be used to reaching out for emotional support, because you're not used to that. You're used to just the task, this been done, that been done, that been done, but not checking in with how you're feeling today. I think there's a lot of food for thought there.
Yeah. Well, you could say that, attending to emotions very early on is a necessary developmental experience, right? So as a parent, you've got to attune to the emotions of the child, and the child in turn will learn to attune to their emotions. And if you haven't had that, it becomes a struggle later on to start attuning to aspects of yourself. But having said that, families are different, and there's a lot of richness. In spite of there being challenges, there's a lot of richness, there's a lot of love. I have families who are struggling with serious mental illness, but find that there's just so much love and compassion that really makes things much more within the illness, much more appreciative. People develop together and they support each other in a very loving way. And so it's not a one size fits all, and we can't use the same lens to categorize people. But I think sometimes through adversity, we learn to appreciate our parents, and we think, well, actually, they've been through a lot, and we and you can appreciate them differently, and not just say, well, I haven't got that, and I didn't get that emotional attendance and all of that.
I think you're absolutely right. All of those things are just absolutely spot on. And I think, parents do show love in different ways, and that can affect how we then show love to our own children. And example, I was on the train the other day, and in my field, obviously, I work with children and young people, and I just noticed that on this journey, there were two different parents. One end of the train, there was a gentleman, and he had his daughter. The children roughly the same age. It would probably be about 2.5, not quite 3, I don't think. And the way that the gentleman was interacting with this little girl, he was talking to her. He when she started to get a little bit fussy, he pulled a book out of his bag and was reading to her. It was just so warm. He was cuddling her, and I just thought, wow, how special it must be to be a little girl with this loving parent. On the other side of the train, I had a mother, and she was attentive in her own way. She made sure that the child had the bottle and everything. And she left the child in a pushchair, unlike the gentleman who put the child next to him on the seat on the train. And she went to sit down, and of course the phone came out, and she's on the phone. The little girl starts screaming at the top of her head, throws a bottle on the floor, and she's screaming. The mother's becoming increasingly agitated because she's trying to talk to this person on the phone, and the child's, in her view, having a tantrum. And I just wanted to say, the little girl, and the girl was lifting her arm, she wanted to go up the pushchair. Eventually the mother took the girl up, put her next to her, and then the girl knelt into the mother and was trying to talk to her, but mum was on the phone. And then the girl sat there, and then after the screaming, she just sat there, and she was passive. She didn't look out the window, and she was just staring. And I just thought, my goodness, the two different experiences, how will that play out later in life? Yeah. And I know you shouldn't be judgmental. Maybe it might have been a one-off, but I don't know, and I can't say. It's a snapshot into the lives of two children of very similar age and their parenting style.
Yes, yeah. And I think some of this is about knowing.
Yeah.
And appreciating that every day in the life of a child is valuable, because, everything, they're constantly learning, and they're engaging with their environment. And a child who's not speaking is still engaging with the environment, and they need, in fact, more because they're not speaking yet, right? So you need to really go in there early. And I think parents are different, but Having said that, we never really know what's going on.
Indeed. Indeed.
And when she goes home, she may then take out her books and then,
we
sit
don't
with
know
her.
that.
And
as I said,
that.
it's a snapshot at the time.
It's unfortunate. I think the phone, social media and the phone is big. I think that more and more different countries are responding. Like in Australia, I think there's a 16-year, you're not allowed to use your phone until 16, or social media until 16. So I think people are catching up to this idea that it's more harm than good. For everybody, for all of us, our phone time should be much more, reduced than it is. But I think it's interesting because mothers' relationships with their children are so important, really important, but it's also very difficult. I mean, being a mother myself, I remember, being really exhausted some days. My children would have homework and, taking out the books and then, making sure they do their homework. And it's not easy. And I think sometimes it's expectations.
Absolutely.
Very high bar to what mothers should be doing with their children. And I think it's a very sort of, changeable, flexible experience. And I think we should not underplay affection, warmth and affection. Absolutely. As long as there's enough warmth and affection, I think
that's one. Pick the little girl and put her in her lap and continued on the phone, but she's got the closeness. Maybe that would have, but as you say, we don't know what else was going on around her at the time, and that's fine. And as a parent myself, I've been there. I've cried over the homework where the child doesn't want to do the homework and the homework has to be done. I've been that parent as well, so it is really, really, really difficult. Before we sort of walked towards the end, because we are running out of time. So in my role as an educational psychologist, I've seen a steep increase in the number of emotionally based school avoidance, where young people are just not attending school, some as young as primary school, because of anxiety and depression, not being able to leave the house, being fearful of people. Is this just the start of things that are going to be worse for them later on in life? I mean,
I don't know. I think there's a lot of change with COVID. Since COVID-19, I think there's been a huge sort of gap, like you said at the beginning, children interfacing what we call normal environments, especially children who've been through COVID. We know now that they've just been sort of, almost irreparable damage to them, and they need to catch up in a significant way. Having said that, I think that for everybody, and I think we cannot underplay the projection that happens in the home, the anxiety that we sort of impart to our children living with them in the home. So I think a lot of that is often the case where, we're not doing the preparation at home in sort of supporting our children to take that next step, and possibly baby steps, doing things in a very gentle way. And it's okay to be different. It's okay, if we feel that society is changing, maybe we need to listen in to what's going on to our society. There's a lot of the world is a scary place at the moment. We just have to put on the television to see, well, actually, all of that is being transmitted. It's
absolutely. So the children have been exposed to all of this.
Absolutely.
Once upon a time, as a child, we were never allowed to watch certain, TV programs, but they're not sheltered from this. And I think they cannot, psychologically, they cannot cope with the amount of stress in the world at the moment.
We're going through too much.
Yeah, exactly.
It's being permeated. It's not impermeated.
No.
It's going through.
Yeah.
And so naturally, we cannot underplay the systemic effects of what's going on in the world, entering the home, entering the minds of children. And I don't think we're doing enough to change our world. I think it starts with really trying to look at ourselves as a society and take responsibility. What kind of world do we want to live in? Because a child at home is no different from a child in a war zone. We need to be thinking about children across the world and try to do our bit. And I think as a systemic therapist, I see people who've traveled across. I've had patients recently from Afghanistan who've come across with their children, and it's very frightening, the trauma that they experience. And I don't think we can completely shelter ourselves from the experiences of the rest of society in other parts of the world.
Suppose we can't let you go without understanding how you look so beautiful, radiant, composed, and you're juggling this, definitely, you're juggling this challenging role, you're professionally, and then you've got your 3 teenagers and upwards. So how do you balance that for the working women out there who are juggling, maybe experiencing mental fatigue or burnout, like I've said? What advice and strategies would you give for them? How do you personally keep all the plates spinning?
Well, I wish I could be, honestly and authentically a role model to answer your question and say I've got it all sorted for myself, but it's quite the contrary, and it's still a work in progress. I think I love my work. I absolutely love my work. And I think there's not a day that goes by when I don't just jump out of bed looking forward to going into work. And I think that for me, if people and young women, especially young people, and I say this to my children, find that if you're going to be working, you're going to be spending a large chunk of your lifetime doing that. Yeah. Find work, find a way to impart or enjoy what it is that you do the most. Yeah. So find that niche. Now, it may be difficult earlier on, but find a way to gravitate towards that aspect of yourself and seek pleasure in what you do.
It's very good advice.
So important. And I think it starts with that. And then it's also the way you work. And I think it's so important to be authentic. I think a lot of our work is robotic, inauthentic, don't connect ourselves with what we're doing. We do a lot of, tick boxing, bureaucratic stuff, and we need to see and find meaning in what we do, connect with that meaning. And and I think take time for ourselves. I always take time for myself. Sit up. If you're sitting in the chair, sit up, stretch yourself, go for a small walk, 5-minute walk around the block, come back and read, find joy in the things that you're doing. Read, meet friends. My husband and I, we have a date night once a week. With that, we do not compromise on that. Good. We have turns on what to do. Just sort of seek joy in our relationships.
So that's seeking joy, enjoying what you do. And some people aren't lucky enough to be in a job that they enjoy, or they started off enjoying it because things got in the way and they no longer enjoy it. And then they feel a little bit disillusioned, maybe disempowered, and don't know where to go, and maybe stay in a job for too long and the joy's completely gone. And that can contribute to the mental stresses. But, it's about taking action, as you say. It's about baby steps, planning your week, as you say, finding the joy in not only your work life, but your personal life as well. And I think those things are really important.
And taking time for yourself. And I forgot to say, a very important thing is boundaries. Know your boundaries with other people, because at the end of the day, people will want of you, but you need to protect yourself. Boundaries are essential. So, for example, emails, manage the influx of emails, put time aside. I'm going to spend 1 hour dealing with emails and responding to that. Admin, that hour, and that's it for the day. I'm going to do other things, and put in snippets of things you enjoy.
I subscribe to that view. I try to practice that every day. It's not always easy, but I think if you've got it in mind, then the intention is there, and you're probably more likely to achieve it. I write everything down and I hold myself to account at the end of the day. Have I done that? If not, I can try it tomorrow. And that barometer every day, am I feeling joyful? Am I happy within myself? If not, what actions can I take? So that's all really important. And I think what you said is prevention is the best way. So
looking after yourself, knowing yourself, understanding your needs before anything else, and protecting yourself. So there's a lot of self-development in this, and it's never too late to develop. You're 60 and developing and understanding yourself. If you need to get therapy, I can put on I can send you, and you can attach to the website. It's free therapy for Black African Asian communities. You can access free therapy if you can't afford it. If you can afford it, there's something called the Bartin Network, Black African Asian Therapy Network, and they're a host of therapists there with all sorts of specialisms. If you need a bout of therapy, there's no shame in talking to someone about your difficulties.
And if you're not Black or ethnic and you're, one of the doer followers, where can other people more generally go?
Mind is a very good resource. Mind is a very good resource. And there's Lambeth Mind, there's Southwark Mind, and there are loads of resources on there. There's the Royal College of Psychiatry website for more sort of, nuanced, more serious mental illness related things. And there's things on ADHD and autism. And, we didn't talk about increasing need for or awareness about ADHD and autism. That's a big thing.
It's huge at the moment. It's huge. Yeah, it's huge. But I think thank you for sharing the advice. Thank you for the signpostings to some of these. We will endeavour to, do a link so that people know where to go. But I suppose if you are worried yourself, or if you've got a friend or a loved one that you're worried about, then it's important to seek support. Is that what we're saying? Go
Absolutely.
Get medical.
Samaritans, if they really are, urgent, the 24-hour helplines, and obviously A&E, and go to your GP. So please, do seek help and get the appropriate help. Don't leave it to fester.
Dr. Aneesa, it's been a pleasure. It's been a pleasure talking about such a difficult subject and a sensitive subject, but something that touches us all, each and every one of us. It will touch us either personally at some point of our lives, or it will affect us through the people that we love and care about. So maybe at another point you'll come on and we'll talk about another aspect of your work. But I'm hoping today that the doer followers will have gained some knowledge on some of these mental health problems. Will gain some inspiration. It's all about inspiring people. So all the tips about taking care and self-care and self-love and nurturing that love and connectivity in your very young children from a young age, and just being aware of the impact of outside influences and how you're thinking and feeling and behaving, and taking care of yourself. So thank you. And we look forward to seeing you again another time. So thank you very much.
Thank you. Thank you very much.
Thanks for tuning in to Diary of a Working Woman. I hope you found this episode as motivating and uplifting as I did. Please follow me at Doer Podcast on TikTok and Instagram. For now, I want to say bye-bye and keep striving to be the best version of yourself that you can possibly be, wearing all the many hats that working women do. Sending you love.